Good morning. My name is Richard Wexler, and this is Caring in America, the podcast for caregivers. So before we introduce our guest, I want to do a little recap, like I always do, of who I am and why I'm doing this. So about 18 years ago, minding my own business in the software industry, married later, two small children, one 11 and one 7. And in the summer of 05, start getting 4 phone calls, each one of our parents. We wind up taking care of them on an unbelievable journey for 14 years. The last parent passed in 2019 at 96. So about a year or so after this all started, I realized I could barely spell the word care, left what I was doing, started my company Points of Life, started educating folks all over the country about this 4-letter word, care. We were fortunate in that we've been able to touch probably thousands of people. In the end of 2022, said to myself, how do I even get a reach out to more people? And we started the podcast about 6 months ago. So with that said, I want to introduce our guest who will be on in a minute or so. Jake Rankin. In 2005, Jake launched his career in healthcare when he started working as a case manager for a non-medical home care agency in Boise, Idaho. Has his bachelor's degree in both marketing and organizational behavioral skills. Then he decided to go back to school and earn his MBA. So Jake has really worked around the elder care industry in home health, home care, hospice, and home infusion. And he's been the CEO of Talem Home Care, LLC, since its inception in September of 2013. In addition to launching the company, he is also extremely active in the community. Jake, are you there?
Yes, sir. Thank you. Thank you for having me.
Oh, no problem. Welcome. So where am I speaking to? Where are you sitting?
I am in Milwaukee, Wisconsin. This is where I live now.
And so for some of us that don't know Wisconsin that well, where in the state is that?
It's the southern end of the state. We're about probably 2.5 hours from Chicago, 2 hours from Chicago.
Okay. So I assume we're moving towards winter in your location. Am I right or wrong?
Yeah. We had some snow a couple weeks ago, just for one day. But yeah, it's getting cold out. That's for sure.
Interesting. I haven't asked you this question, and I haven't researched it. Are you a sports fan, sir, or not?
I am a sports fan. Yeah.
What are your teams?
Well, I grew up on the West Coast, so I am a Seattle Seahawk fan, big Seattle Seahawk fan.
Wow.
That's my football team, and then Oregon Ducks and Boise State Broncos, and
there you go. Well, living in Boise now, I'm a Bronco fan as well. But having spent 99% of my life in the Bay Area, I'm going to have to take exception with the Seahawks and go with the 49ers.
So, I grew up a 49er fan. And it was probably middle school, high school-ish where I went over to Seattle.
Interesting. Very good. Well, about half the football season over and about half yet to go. So let's start talking about you. And doing some research about you, I saw some things that you had written where some conversations that took place with parents and grandparents, and making sure that you took care of yourself and you didn't get hurt. You know what I'm talking about, and can you kind of talk about that conversation more?
Yeah, sure. You know, like you mentioned, I've been in this industry a long time, and I actually even started as a caregiver prior to that, when I was getting my master's in business. So I've been close to 20 years since doing this.
Wow.
The kitchen tables and stuff. I'm assuming you're referencing, the story of my mom and how and why I started my company, I guess, a little
Yes,
bit.
yes, yes.
Okay. So, I have been in the industry for a long time. This was back in like 2012, I think. I'm a certified senior advisor, and I've worked in hospice, and I worked in home health, and been everything home care related for elder care. And I got a call one day, and my mom was in the hospital, and this was actually a call that I had been dreading, and knew the call was coming, because unfortunately, my mom was an alcoholic, and she was in and out of the hospital a lot, and
Wow.
it was just hard to see her, go through all that. And
Wow.
she was living in Arizona, Phoenix, and I was living in Denver at the time. And so the doctor called me, and she was in the ICU, and she was unconscious, and she was with a vent and a trach and life support, and her liver had failed also. And
Wow.
so I flew out there, immediately flew out there, and was talking with the doctor, and my mom's wishes were that if she didn't want to live on life support of any sort, and she she wanted to have a good quality of life, if something were to happen. And so one of the first questions I asked the doctor was, how does one live without a liver? And I knew the answers to a lot of these things. I've been doing this a long time, but I just needed to hear. I could, hard for me to make decisions. But the doctor's like, well, that's not the right question. We've got to get her breathing better. We've got to get her, conscious, and off life support and things like that. And I kept asking the doctor for 3 days, going around with the doctor. I was like, well, what's her quality of life going to be like? Like, how do you live without a liver? She didn't qualify for a transplant, being an alcoholic. And so, it's not like kidneys where you can go on dialysis. I kept trying to figure out, is she really going to recover from this? And so the doctor was, kind of being very difficult with me for about 3 days. And my mom's best friend, she said, well, you know what you need to do. There's nothing here to do. We need to take her off life support. And it's very, very hard to make that decision for your mother.
Yeah.
And so I just needed to hear from the doctor. And one of the nurses came in, and they took off their name badge, and said, we're getting frustrated. Us nurses are getting frustrated because we're not happy with the way the doctor's treating you. And so he's like, we're not supposed to do this, but you're right. You're asking the right questions. And he kind of made the same comment. There's nothing more to do here. She can't live without a liver. And so finally, I went to the doctor and said, okay, I'm no longer asking you. I'm telling you what we're going to do. We're going to put her on hospice. She wants to go to an inpatient unit per her advanced directives, and I've already made arrangements for that. Let's do that. And the doctor's comment was, you should have done this days ago. And I was so mad and so frustrated. Like, why? And I asked him, like, why did you make me go through all this? He goes, well, I needed to make sure you were in the right mindset to make that decision. And I was like so furious. I'm like, that's not his decision to make. That's not his,
Right.
He put me through 3 days of stress and agony trying to figure out what to do of all this stuff, what I could have made my peace with everything sooner, And then the hospital, on top of that, the hospital it's a very large hospital system, and they own their own home health, and they own their own hospice. And so the social worker came in, and they're like, well, you have to use our hospice. And I'm like, no, I don't. I know. At this point in time, I was a certified senior advisor. I'd been in the industry maybe, I don't know, 8, 9, 10 years, something like that.
Wow.
And And they're like, you have to use our hospice. I'm like, no, I don't. I can choose any hospice I want. And in fact, I know what hospice I want. And I've already made those arrangements. And, so that whole ordeal, I've sat in a lot of, living rooms and kitchens and hospital rooms with, with family, with strangers or other family members, being their advocate and being a certified senior advisor, help guiding them through. But this was the first time that I had ever experienced anything myself.
Sure.
And it made me furious. It made me angry. And I'm like, that the normal thing of, the way the doctors treated me and then the way the hospital treated me, that's just common things that we've always seen in our industry. And it's not right. And so it instead of complaining about it, decided to do something about it. And so that's when I started my company, because, yes, we do the home care, and yes, we do placement services, but the real approach that we take is providing that navigation and avocation services and helping people figure out the right questions and the answers to the right questions so that they can make a better informed decision. And that's what we do for
Wow.
free. We don't charge anybody for that. And I had a
Right.
similar issue with my father-in-law about 6 months later. Again, a different state, but hospital trying to convince my wife to use their hospice and go through their system. But that was going to make my wife drive an hour a day each way to go see her dad, where there was a nursing home down the road, that would take him. We already made the arrangements, and the director of palliative care and the nurse, they're like, well, you can't do. She literally said, you can't do hospice care in a nursing home, and you won't get the same pain medications. And I asked her, if he even qualified for the unit that they were going to put him in, and she was like, well, I don't even know what you're talking about. And they didn't know my background at the time. And again, it was just, it's so frustrating because they're trying to
Yeah.
bully you. And,
Yeah.
I was angry, and maybe I shouldn't have said it, but I said, you're either, shouldn't have said it, but I said, you're either, not smart enough to do your job, or you have a hidden agenda, but there's something not right here, because you can absolutely do hospice in a nursing home. I've set it up. I've done it, So that's just, unfortunately, that's common in the state of America, and that's what we're trying to help combat against.
Yeah, I've obviously experienced that personally, and I've seen it professionally. That it's sad that a lot of people in this elder care industry really don't understand it and make comments like that individual did to you. And at least you had, as you said, pushing 10 years of experience in the industry. We think how difficult it is for the average individual, the average couple, whoever it may be, that are trying to take care of mom, dad, grandparents, etc., and don't have the knowledge and don't have the background that you have. Tell me about the services at Talem that you're providing, both from a home care perspective and also from a placement perspective.
So the home care is, most people, they have a desire to age with grace where they live, and that's what we try to help them with. And so we can help with bathing and dressing assistance, house cleaning, cooking. We've developed we have an evidence-based care transition program that helps people stay out of the hospital, and we've also developed programs to combat loneliness and isolation and depression.
Cool.
Kind of the mental health side of aging with grace. And so, that's one thing we do. And then the other thing we do, if they can't stay home anymore, is we help them find a place to live, and that's a free service. We will help them. We do all the research, and we'll help them. We'll take them on tours and figure out what's appropriate to them. And then the last thing we do is we are a resource center. A lot of times these people will, they end up in the hospital and they think that the doctors and the discharge planners and the nurses, they have, I have to do what the doctors tell me to do, or these people tell me to do. But the reality is that oftentimes they don't know all the resources. They don't know the programs that are out there. They don't have the time to do that research and to do that networking and figure out who's good and not good. And so That's what we do. We're a resource center. We're advocates. Every office that we have across the country um, will have a certified senior advisor in the office, and we, for free, will help people find the resources they need, whether it's veteran resources, home health, hospice, medical equipment, elder law attorney, snow removal
Wow.
service,
Wow.
yard care,
Yeah.
anything that somebody might need to stay successful at home. We'll help them figure that out.
And that's awesome. And I wonder if you actually have been traveling with me and kind of giving speeches with me, because the way you're talking sounds like me. And what's frustrating, and I know some of these folks are out there listening, and I'm being honest, guys and
Yeah.
gals. I mean, what Jake was just talking about, you work in a hospital, you're a case manager, you're a social worker, you're a discharge planner. And I think Jake would probably back me up. And if he won't, he can tell me, you need to understand this, and you really need to understand every patient that you're working with in that hospital setting. What are the next steps? Where are they going to go? How is that going to work? What other services are they going to need? So you folks are putting them in touch with a company like Jake's that can handle this. Because what I see, unfortunately, that patient gets through the hospital, maybe goes off to skilled nursing. There's no conversation at skilled nursing, and I've talked about that. Unfortunately, I've had my own personal experience with that, and no one walked up to me and asked me what my thoughts were and what my plans were, and was I set financially for care, etc., which was a short amount of care, but I needed some care. So this is really important, and I'm glad that Jake is bringing it up. In research I've done about you, and I see your core values: community, family, team, and giving. Can you talk about that a little bit?
You know, it's something that's dear to us, and we try to talk about with all of our clients, all of our caregivers. It's a commitment to a level of quality of service that we want to provide. So, with the community, we want to try to make the community better. People say it takes a village to take care of the elderly, right? But what you described with people going from hospital to home, to rehab to home, or whatever the case may be, there's so many gaps there, and there lacks a central point of coordination. And so the free advice and navigation and being a resource center is our commitment to the community to make it better, to help to make sure people don't fall through the cracks and they have some central
Wow.
point of communication. Family, is important to us too, because I've seen there's a lot of people in my industry in general, that they buy franchises or they start their business because they see that there's a lot of money in this. They can be, right, but you really have to have the heart and passion for that. And so family is kind of our commitment to ensuring that all of our staff tries to they have that heart and passion, and we're going to try to treat you like a family member. We're going to laugh together, we're going to cry together, we're going to hold you accountable to get better. We're not going
Cool.
to let you, we're not going to let you, if you can help us fold laundry, help us fold laundry. If you can help us cook, help us cook. Don't we want you to take, we want our clients to take an active, sometimes tough love has to happen, right? And so that's our commitment to being part of the family and being that advocate, and working with them or their loved ones. And then that's teamwork. It's building that village and working with other referral sources and other resources out there, volunteer organizations, veteran organizations. And it's ensuring that everybody on our team is willing to step up and kind of go that extra mile. And then giving is, we want to donate a portion of our profits back to charity. And so we
Awesome.
work with various, we work with charities, and we volunteer our time with charities, and then we also donate a portion of our profits, trying to
Awesome.
make everything better.
What On every episode, I talk about a four-letter word that people hate, and that four-letter word is plan. And what I'm happy to see all the things you are doing for the individual, for the family, and that's fantastic, and I love it. And I think you may be in agreement as well. I would love to see, and I've been talking about this for the 18 years I've been in this industry, the idea of families having this conversation about what will happen. What if something happens to mom or grandma or in-laws or whatever it may be? Because my assumption, and again, you can correct me if I'm wrong, most of the people you're probably working with, whether it's from a home care side or the placement side, are probably coming to you in crisis. Would you agree with that, or am I wrong?
Yeah, yeah, yeah. Unfortunately, the people don't pre-plan very well, and so we do work a lot in crisis mostly.
Wow. And
And then,
go ahead.
well, and then our job is to be the calming factor and try to take the stress away from the client or the patient and the family member, so they could just focus on
Yeah.
getting healthy and spending time together. And then that's where we start the planning process, and helping them ask the right questions. Have you
Which again,
thought
I
about Medicaid
love.
spend down?
Yeah.
All sorts of stuff.
And I just wish people, we talked about this all the time. West Coast people talk about these vacations to Hawaii, East Coast, the Bahamas, folks. This is real. It's going to happen to most of us. It happened to me, yeah, a short version of care, but I've already been in skilled. A lot of people haven't. But this is going to happen to a lot of people. And most of us would rather control our lives and decide what we want and where we want to live and who's going to take care of us compared to dealing with it in crisis. Also, in researching you, one thing I've seen is you're franchising. Tell me
Yep.
when that started, where the home office is or was, and where you have locations around the country.
Yeah. So my heart and passion has always been in senior care, but in college I was an intern for the SBA, and I coached and counseled small business owners. And that's never that passion for helping small business owners never went away. My entire career, I was always helping out, and I even had my own consulting firm when I first started this business, also. And so the idea of franchising, somebody brought it up to me, and they're like, "Well, why don't you? You love senior care. You have this brilliant plan and mission on how to make communities better." And you like working with entrepreneurs and helping entrepreneurs realize their dreams. Why don't you kind of marry your two passions and turn it into a franchise system? So we did. We started that process in 2015, and then we started selling in like 2017. And our growth plan, we're small. Our growth plan is very slow and controlled growth. Part of our commitment is, we don't want to be like the other larger brands that it's a factory hammering out franchise owners. We want to take a very hands-on, active approach to the training and support and ensuring success of our franchise owners. So we only want to bring on, if we're lucky, one or two franchises a year. We're that hands-on. We don't know if we want to take on much more than that.
No, I
So
get it. That's that. Go ahead. That's great.
yeah, and so there was a second part to your question there, I think you had. I don't remember, but yeah, that's kind of how we
Where
got started.
where was the first location, and where are you guys located now?
So the first office that for my company, I started in Broomfield, Colorado. That's kind of been our headquarter area. Then I started one. Also, I own the one here in Milwaukee. And then since then, we've grown location-wise to, I think we got 3 in Colorado, 2 in Connecticut. We've got 1 in Georgia.
Wow.
He hasn't started yet. He's getting things going. Unfortunately, we've had a couple close just because franchise owners, it takes a lot of work to do this, and it's hard to be
Sure.
an absentee owner in this
No, I get
industry.
it.
But I think we've got one coming in Texas soon. So
Oh, cool.
um, And now we're moving our headquarters more to Milwaukee since I live here now.
Okay. Very,
So
and then now I have that horrible question that I have to ask you, but I need to help people understand from it. What is there an average hourly rate across these different locations that you guys normally charge?
that's a big. There's a difference in the market. I would say the average right now in a lot of markets is I've seen as low as 30 and as high as maybe, well, 30 to 35 in a lot of markets. Denver or Colorado in general, Wisconsin in general, you're getting closer to $40 an hour. Actually, 45 in Colorado. Um, so, but we specialize. That's an issue you'll find with discharge planners and doctors and various healthcare professionals. Is oftentimes they don't want to refer to healthcare companies that cost money out of pocket because they don't want to spend their clients' money. And um, I think there's a lot of if you need home care and can't afford it, there's a lot of volunteer organizations in most markets that can help you. But
Sure.
there's also ways and funds to help pay for care too. So it's not always have
Yes.
to be out of pocket. There's local grants you can get in with different counties that we work with. We do 2 different veteran programs.
Yes.
It's very rare to do that, and a lot of people don't understand that. Most people maybe didn't plan for long-term care insurance, which if you don't, you should right now. Definitely get it.
Yep.
But even life insurance can now be turned into long-term care, and there's I guess what I'm trying to say is there's a lot of different ways to help pay for care. So don't be afraid to ask for the help and to research it.
Aw Awesome advice. Awesome advice. I talk about over 10 different ways to pay for care. Most people don't realize that. That's part of that four-letter word again, plan, trying to understand. You have a mom that's 80 years old, she's starting to change a little bit. Okay, you should have planned for this a long time ago, but let's start now because these costs are realistic. And then I tell people your other choices are you're going to move to mom's house, wherever that may be. Mom's going to move to your house. And how are you going? Believe me, I understand this because I've done it. How are you going to manage your life? How are you going to manage your work? All of that when now mom's living with you or you've actually changed locations. And Jake knows this very well. So many people don't live near
Right.
mom and dad,
We've got a program specifically for that too, um, to
which is
help
fan.
with those.
Go ahead.
Yeah, I would say the same thing. And I do want to add with the planning. Most doctors, most discharge planners, and even most people in my industry, um, Medicaid planning and spend down is a real thing, and most people these days are needing to go on Medicaid. And the thing most people don't realize is there's a 5-year look back period. But if moving into an assisted living is some point in your future, you want to move in sooner than later. Don't wait because most of them have like a 2-year spend down period. So if you wait till your money's gone and with a home care agency like myself, or you move into an assisted living, or you don't move into assisted living, where the case may be, um, if you wait to get on Medicaid first and then move into an assisted living, you're not going to be happy with where you move in to. So, um,
Excellent advice.
you need to plan ahead of time, and most agencies
Yeah.
don't think about that.
And folks, you get tired of me and my guest talking about this planning, whatever you want to call
Absolutely,
it. But
we have a
it's
whole workbook you can work through.
there you go. It's real, and I don't know any other way. In all these episodes to tell you, folks, it's real. And again, would you rather be completely surprised when mom's flat on her back in the hospital having broken her hip or dad's had a stroke or whatever the case may be? Or would you rather know and try to get ahead of all this? That's fantastic advice. Before we head out, I do want to ask you about something else that you're heavily involved in, and that's the Love Thy Neighbor Foundation. What is that, and what are you guys doing?
So, the Love Thy Neighbor Foundation has been around for about 6-7 years, and it was founded by a gentleman named Al Emmons, who's currently, I think he's currently 87 years old. And as he was aging through with him and his brothers and his wife, and he saw the same things that we saw. There's these gaps, and people don't know all the resources, and how do you connect the dots? And he's trying to build that village. And so, him and I met years ago. And just our philosophies and approach to care and our commitment to the community just perfectly aligned. And so this last year, I took over as president and chair of the board of the foundation, and we have an online resource center. We have information and resource hotline. We do workshops to try to get the information out, and we're really just trying, like I said, to build that village of providing support, and so that people know all the resources and have all the questions they have. So right now it's primarily focused in the Milwaukee area. We're working on some fundraising. We really use a lot of fundraising right now. And then once we get things built up a little bit more, our hope is to get this launched in other markets across the country.
Wow. That's fantastic. I wish there were more things like that having been built around the country or potentially getting built in the future. One thing before we head towards the end, two sets of contacts. Is there a phone number they can reach you at, a website for home care? Is there a website for Thy Neighbor Foundation? What do you want to give us, Jake?
Sure. So for my website for my company is simply just talemhomecare.com. You can go there. You can learn more about our services and what we provide. Then you can find the locations that we're at. Or you can call, it's 833 Talem HC is the 800 number to reach me. To reach me here. With the Love Thy Neighbor Foundation, it literally is just lovethyneighborfoundation.org. You can go there, see the resources that we have available in the Milwaukee, Wisconsin area. And their phone number is 855-LOVE-THY is their phone number.
Perfect. So again, hang on there in there, Jake, but I want to say, first of all, thank you for all of this. Home care, great foundation, placement, helping people learn about this, helping people learn about the locations that you have around the country and the growth that you're talking about. Because again, folks, I keep saying the same things over and over again. It's real. It's going to happen to most of us. You truly want to get ahead of it because Jake sees it. I've seen it. It's not as much fun when you're dealing with this and a family member or yourself from a situation where something has already happened. The diagnosis of an illness, a stroke, something that's broken, etc. And folks, as I talk about on every episode, if you want to reach out to me, I'm about to give you an email where if you're an expert in some form of elder care, let's talk. Let's see about getting you on the podcast. You're out there, you want to share a story, whether it's personally about caring for a loved one, or you want to share a story and you are a professional in the industry that was about a client or about a patient, please reach out. And that email is eldered2023@gmail.com. So once again, folks, as I say in every episode, as we get ready to sign off, I thank Jake again. And until we talk again, please have yourself an awesome day.